Good morning, everybody. It's Monday, and today I'm going to talk about hepatitis. It wasn't my initial plan for today, but since it's a current issue, I'm going to discuss it with you guys and provide you with some education in what I know is going on. So, in summary, you've heard about this a lot, but so you have a synopsis of what happened and how this came about. So, in Alabama, from October of 2021 to February 2022, there were 9 previously healthy children who were between the ages of 1 and 6 who ended up with liver infections and having hepatitis. There are a couple more cases scattered in the U.S., but honestly, I can't comment on which states and where everyone is right now. So, about these children in Alabama, what we know, they were ill enough to require hospitalization. So they were very sick. When you read about their symptoms, it wasn't just a simple stomach bug. These kids were very, very sick and showed a lot of symptoms of hepatitis, which I'm going to go into later. 2 of these 9 kids ultimately had to get liver transplants, which can be very scary. Also, there are multiple cases of severe hepatitis among healthy children age 1 month through 16 years worldwide. So that's how this became a thing, is because it's not just happening here. We are noticing, this happening worldwide, okay? So there have been over 160 cases in 12 countries. Internationally, there has been 1 death out of 169 total patients that we're talking about at this time. Now, this is from last week. I don't know if there have been any more deaths since then. So as of last week, there was 1, okay? 114 of these 169 cases are focused out of the United Kingdom alone. So around here in the United States, we do not have as many cases yet. So also, adenovirus seems to be a common factor. It has been found in 74 of the cases internationally. And so now the local authorities are trying to determine, is this a trend here in the U.S. as well? COVID was also identified in 20 of the international cases, and 19 of those total cases had COVID and adenovirus as well, okay? So that still is a possibility, but that's a low number that had that cross-infection. It's important to understand this is very rare. It's still scary, but it's rare. So it's important to understand, what does hepatitis actually look like and what do you need to look out for, so you know when to be concerned. So hepatitis is inflammation of the liver. It's typically caused by viral infections, alcohol use, other toxins, certain medications, and certain medical conditions will cause hepatitis. We do have vaccinations in place for specifically hepatitis A and hepatitis B. Kids are given these as part of their routine childhood immunizations. So those are preventable forms of hepatitis. It's important to understand, too, that these, the hepatitis cases we're seeing are not a specific type of hepatitis at all. So they're not typing it as A, B, C. Like, we can't figure out, it doesn't have like a type yet. So what are some signs and symptoms of hepatitis? This is what you want to pay attention to, okay? It's going to be a combination of these things. So we've got fever, fatigue, which is being tired, loss of appetite, nausea, vomiting, abdominal pain, dark pee, light or a white colored stool or poop, having some joint pain, yellowing of the skin, which is called jaundice. So you see that sometimes in babies. Yellowing of the eyes as well. So the white parts of the eyes having yellow there. A child who has hepatitis is going to appear very ill. This is not going to be your typical just, oh, we have a fever, vomiting, diarrhea, stomach illness, okay? These kids are going to look very sick. So what should you do if you are concerned? You should call your pediatrician right away. If you can't get a hold of your doctor and your kid has any of those signs, you just go to the emergency room and you get evaluated. That's okay. The other thing I wanted to say is there's just still a lot of investigation going on as to this cause. So I don't want you to leave this video being like, oh, if my kid has this simple virus called adenovirus, oh my gosh, we're going to end up with hepatitis. It's not that. I mean, we see adenovirus all the time. Every pediatrician will tell you that. we don't usually test for it either because it's just another virus. So adenovirus is going to be anything from, respiratory symptoms like a runny nose, cough, pink eye, to diarrhea, fever, vomiting, illness. So if we tested every child for every virus in the world, we're going to come across it. So now we're starting to try and make some correlations, though, with the kids who do end up in the hospital with this. Is there some kind of cause or triggering event or something? So I just wanted to provide you guys with a little bit of an update, what I know. Feel free to ask questions, comment, whatever. I hope this is helpful to everybody. Bye.